A season that we are all familiar with, but we also have the power to control. Joining us this morning, right here in Spotlight on Now, is none other than the Honourable Minister of Health, Dr. Terence Deyalsingh, and Dr. Baychan. Good morning to both of you and welcome to the show.
Good morning, and it's Mr. Terence Deyalsingh or Uncle Terry. Take your pick.
My apologies. Good morning, Uncle Terry. Mr. Deyalsingh, welcome to the show. And of course, again, welcome,
Thank you.
Doctor. Thank you for being with us so early in the morning for such a critical conversation. As we said, the flu season is something that we all talk about, everybody experiences, but we don't necessarily take the power and deal with the situation by getting vaccinated. Let's jump straight into the conversation. If we could start with you, Minister, about the priority of the influenza vaccine in the Ministry of Health.
Thank you. So the influenza season, and I think at the onset, and Dr. Baychan will go into detail, there's a huge difference between the influenza, which we are vaccinating against, versus the common cold or the flu, which we are not vaccinating against. And Dr. Baychan will go into those differences. Basically, the influenza season, which if you get influenza, especially influenza A, H1N1, H3N2, that can land you in a hospital and you can die. That season runs from October of any year to May of the following year. It corresponds with the cold seasons up in the northern hemisphere, where these viruses start to circulate and then they find their way down here. We have started to vaccinate against influenza, not the common cold, about 2 weeks now. So far, we have done just over 6,000 vaccines. The numbers are pretty low. And why? Because we have not announced any deaths as yet. What we notice whenever we announce deaths from influenza, people rush to get vaccinated. Last year, we had 5 deaths, and we vaccinated about 45,000 persons. This year, we have announced no deaths, and it's only 6,000. We have our mass vaccination sites up, and I want to thank all the malls who are working with us, Trin City Mall, West Mall, Gulf City Mall, and so on. And these sites are going to be available until end of next week. After that, we go back to the usual health center setting. So I am urging people to be proactive, especially the elderly with comorbidities, with diabetes, sugar, pressure, to get vaccinated because you are most at risk.
Very important. Thank you for that, Minister. Dr. Baychan, bringing you into the conversation this morning. Can you share with us the differences between influenza, the common cold, and so much more?
Good morning again, everyone. So there are some similarities between the common cold and influenza. However, as Minister said, influenza tends to be more severe. So symptoms usually start the same: fever, cough, runny nose, sore throat, right? But with the influenza virus, you tend to get a little more severe cough, severe fever. You may also have other symptoms such as vomiting, diarrhea, body pain, loss of appetite, severe weakness. And those symptoms are what usually land a patient into hospital.
Wow, definitely. And as you mentioned that, the first thing that will come to many of our minds is children as well, in particular. Let's talk about the safety of the vaccine for children, because that's always a concern for parents.
Well, the vaccine is very safe. The vaccine is safe for all adults, for children, for pregnant women, and there are certain groups of persons who are considered at risk because when they get the virus, because of their immune system not being as strong as an average person, they are more likely to have the severe symptoms. So these groups are children between the ages of 6 months to 5 years, adults over the age of 65, persons with non-communicable diseases such as diabetes, hypertension, heart disease, kidney disease. Those persons, together with pregnant women and other persons with a compromised immune system. So a person who has tuberculosis, sickle cell, anemia, AIDS, right? These groups of persons are considered high risk of one, contracting the illness and also having really severe symptoms. So those are the persons that we encourage to take the vaccine. Other than that, the average person at home may not be within any of these categories. However, when we have families, right? So even as a healthy, quote unquote, healthy adult, you have your parents, you have your grandparents, you have children around you. And if you know how the virus is shared, it is shared by what you call droplet. It's shared by a droplet. So a person who has the influenza virus, if they cough, if they sneeze, and any person who is within close proximity to them can get the virus. So even the healthy adults, we may not have severe symptoms. However, we may be the vector that carry the virus to the persons who are at risk. So it's important for us, for everyone, more or less, to get the vaccine because you protect yourself and you protect your loved ones.
Well, something that you just mentioned there, Doctor, is so important, the fact that sometimes we may be carriers of something and we have no idea. So what can we do as individuals to ensure that we keep that spread to a minimum?
Well, definitely, coming out of the COVID pandemic, washing your hands, personal health etiquette, right? When you know if you have mild symptoms, you have a sore throat, you have fever, you may have a runny nose, you abstain from the public, abstain from other persons, because that's how you spread, right? Um, Taking care of yourself, uh, um, drinking enough water, right? Having a healthy diet, all of these things helps us even when we have symptoms to be able to fight. And the one thing that you can do for sure to prevent yourself from having severe symptoms is take the vaccine. Once you take the vaccine, the vaccine allows you to gain immunity, right? It teaches your immune system how to fight the virus without actually getting the full-blown symptoms of the influenza virus.
Definitely. Minister, one of the things that you mentioned were the mass vaccination sites. What about going to the health centers? Do we have that option to get vaccinated?
Yeah, so you have over 100 options of allocation. We have put the vaccines in all health centers. But to assist the public with convenience, we have also put it into 7 mass vac sites. And the malls are the key ones. So City Mall, thank them. Gulf City Mall, thank you very much. West Mall, thanks. And the Paddock, Queen's Park, Savannah. But these sites are temporary. They are only going to be up for 3 weeks. Today is the start of the 2nd week. What I'm urging persons to do, take advantage of these 7 mass vac sites. Point Fortin Hospital. It's convenient. It takes you less than 10 minutes. After this 3-week period, which ends next weekend, then we go back to the health centers. And I am urging people, be proactive, safeguard your health, safeguard that of your loved ones. Don't wait for us to announce that unfortunately someone has died from influenza, and then there's a rush for vaccines. The mass vac sites have been closed, and then you have to go to your health centers. So we put these 7 mass vac sites up for your convenience, but the uptake has been pretty low. We have done just over 6,000. By now, we should have been doing between 10 to 15,000. Last year, the uptake was high because we had 5 deaths early in the season. A couple of years before, we had 51 deaths. We did 125,000 doses in that year. So there's a clear correlation between, in the public's mind, that they hear no deaths, so they get complacent. They hear deaths, they get proactive. Let's be proactive, and let's prevent deaths, especially with the elderly, because they carry the brunt of influenza A. They carry the brunt of being hospitalized, of going to an intensive care unit. Let's avoid that and be proactive and get our numbers up. 7 mass vac sites. I don't know if you have the flyer that we sent that we can put up on the screen. If you don't mind, I could call them out.
Yes, please.
City Mall, Monday to Sunday. UTC Compound, Sangre Grande, Monday to Saturdays. Mayaro Regional Corporation car park, Monday to Saturdays. The paddock on the Northwest. So that runs the falls at West Mall. I was there on Saturday, Mondays to Fridays to Sundays. Southwest Gulf City Mall, they are doing some good numbers. And Point Fortin, the ground floor of the foyer at Point Fortin. But in addition to this, all the health centers are also running at the same time. So convenience is there. Take advantage of it. We need people to step up now, take advantage, and let's break the cycle. Don't wait until your relatives start to come home for Easter, not for Easter, for Christmas and Carnival, and then bring the virus down here from North America. And that's when all hell is going to break loose. So let's be a little bit proactive.
Critical seasons, and as you mentioned in the beginning, Minister, we start from October, we go all the way into the following year, and this is when the foot traffic in Trinidad and Tobago, air traffic, everything goes through the roof. Now, Dr. Bechan, coming to you for a quick moment, just going off what the Minister would have mentioned with the fact that we need to be proactive. We see many people say, well, even if I take the vaccine, I'm going to get the influenza anyway, so what's the point? Now, what words of wisdom would you have for those people who will use that argument going down into the conversation?
Right. So, as we said before, when you get the vaccine, your body builds immunity to it, which means your body learns how to fight it. So that if you actually do contract the virus, the symptoms are going to be nil to very mild. So again, other than the benefit to the person not getting the full brunt of symptoms, you have the fact that if you get the vaccine, you build immunity, you don't have symptoms to be able to spread it to other persons. That's the big thing that you're trying to take away here from getting the vaccine. So even though, yes, the symptoms may be mild, we don't want to be the vectors to transmit to our at-risk population, our children, our elderly, our pregnant women, right? Our patients and our loved ones who have chronic illnesses. So even though, yes, the symptoms are mild, the vaccine is still important to get. Also, one thing to note is that some persons also say, oh, I got the vaccine last year, I don't need to get the vaccine again this year. The reason for that is that every year there's a new flu vaccine, influenza vaccine, because there are different strains in the environment. And a new vaccine is created every year to incorporate those new strains that are in the environment, right? So that's why it's important to get the vaccine every year. So we get immune to the new strains.
Thank you so much for sharing that. Dr. Bechan. Now, before we close today's conversation, Minister, do you have any words for the public of Trinidad and Tobago and the nation as well, and those who are outside who are watching right now?
Yeah. So this time of the year is not only about parang and black cake and buying presents. It's also about protecting yourself, because as I said, as your friends and relatives start to come home for Christmas and into Carnival, from the cold climates of North America, England, Europe, they are going to be bringing down the influenza that is circulating there and infect us here. That has been going on for decades. However, we now have the tools at our disposal to break that transmission, to protect our elderly especially our elderly with sugar, diabetes, the obese, the overweight, the pregnant, the at-risk groups. If you're asthmatic, our children in schools, let us protect them. Let us make sure that we break the cycle of transmission. Let's make sure we build up a certain degree of what we became familiar with in COVID, herd immunity, where we vaccinate as many people as possible, many people of the herd as possible, to break this transmission. So my final appeal to Trinidad and Tobago: get vaccinated. It may save a life. It is against the influenza virus, which is different to the common cold. The common cold does not kill you, but the influenza virus, you can wake up this morning and by this afternoon with influenza A especially, land up in an ICU. It comes up that fast. It's that serious. It's that severe as opposed to the common cold.
Thank you so much, Minister, and thank you so much, Dr. Bechan, for joining us this morning on the Now Morning Show. Wishing you both a wonderful day.
Bye-bye.
Bye. Continuing the conversation here on the Now Morning Show, we're about to pause for a quick pause, and we'll be back. Stay tuned.